Did you know that stroke is a leading cause of serious long-term disability? It strikes suddenly, often without warning. And yet, countless people, especially as we get a little older, miss the critical early signs that could make all the difference. It's a heartbreaking reality that many face, where precious minutes are lost because symptoms are dismissed as something less serious, just tiredness, stress, or maybe a minor ache. But those moments are when the brain is under attack, and every second truly counts. Imagine the difference it could make if you or a loved one knew exactly what to look for in those first crucial minutes. That knowledge isn't just power, it's protection. It's the difference between a full recovery and a life-altering disability. In this video, we're going to uncover the 7 early signs of stroke that far too many seniors unfortunately overlook. These are subtle clues that your body might give you, signals you absolutely need to understand. Being aware of them can empower you, your family, and your friends to act fast, because swift action is the single most important factor in stroke recovery. We'll walk through each sign, explaining what it looks and feels like, and most importantly, what you must do if you spot them. Knowing these 7 signs could quite literally save a life, maybe even your own. Make sure you watch all the way to the end, because there's something crucial we need to talk about regarding what happens next. And it might just surprise you how simple, yet critical, it is. Let's dive right into these vital signs, starting with one of the most common and recognizable ones, though still frequently missed or downplayed. The first sign we need to be acutely aware of is sudden facial drooping. This often happens on just one side of the face. You might notice a corner of the mouth seems to droop, or perhaps one eyelid seems lower than the other. Someone might smile, and only one side of their face responds normally, while the other side looks slack or uneven. It's not just a little tired look, it's a noticeable lack of muscle control on one side. People sometimes brush this off as just feeling a bit odd or tired, maybe thinking they slept on their face funny. But it's a strong signal that something is wrong. To check for this, a simple test you can do is ask the person to smile, if their smile is uneven, if one side of their face doesn't move or droops downwards. That's a red flag, a very bright one. This happens because the stroke is affecting the part of the brain that controls facial muscles. The brain isn't sending the right signals, and the muscles simply can't respond properly. It's a sign that demands immediate attention, not a wait-and-see situation. Don't tell yourself, oh, it's probably nothing. They just look tired. That kind of thinking is dangerous. If you see this, or feel it yourself, it's time to act. And quickly. Moving on from the face, the second crucial sign many people miss involves the arms. This is sudden arm weakness or numbness, typically affecting just one arm. Someone might try to lift both arms in front of them, palms up, and find that one arm drifts downwards involuntarily, or they can't lift it at all. It feels heavy, weak, or unresponsive. Imagine trying to reach for something and your arm just doesn't have the strength, or trying to carry a bag and one arm feels completely useless. This isn't just feeling a bit tired, it's a sudden, unexpected loss of strength or sensation. Again, people might think they just pulled a muscle or maybe it's arthritis flaring up, especially if they already have some aches and pains. But the key word here is sudden. Did this weakness or numbness come on abruptly? That's the critical distinction. To check this, you can ask the person to raise both arms straight out in front of them, palms up, and hold them there for about 10 seconds. Watch if one arm starts to fall or drift down compared to the other. If it does, even slightly, that is a significant sign of potential stroke. It means the part of the brain controlling movement on that side of the body is being affected. Just like with facial drooping. Ignoring this and hoping it gets better on its own is risking severe, permanent damage. It requires urgent medical help. The third early sign, which is often linked to the first two because it also affects communication, is sudden difficulty with speech. This can manifest in several ways: slurred speech, difficulty finding words, or trouble understanding what others are saying. The person might sound drunk, even if they haven't had any alcohol. They might try to speak, but the words come out garbled or nonsensical. Or they might seem perfectly lucid, but when you speak to them, they look confused and don't seem to grasp what you're saying. They might know what they want to say but are unable to form the words properly, which can be incredibly frustrating and frightening for them. Again, the key is that this comes on suddenly. It's not their usual way of speaking or their usual level of clarity. Someone might dismiss this as being tired or stressed, maybe having a dry throat. But if their speech is suddenly slurred, if they can't repeat a simple sentence you give them accurately, or if they suddenly seem unable to follow a conversation, that's a major warning sign. To test this, you can ask them to repeat a simple phrase, like, "The sky is blue." Listen carefully. If they slur the words, can't repeat it at all, or say something completely different, it's time to be concerned. This points to the stroke affecting the language centers of the brain. Recognizing this immediately is vital because communication problems can make it harder for the person to tell you something is wrong, making it even more important for you to spot the signs. These first three signs, facial drooping, arm weakness, and speech difficulty, form the basis of a very well-known and easy-to-remember test called FAST-F for face, A for arms, S for speech, and T for time, meaning it's time to call emergency services immediately if you observe any of these. But there are other important signs that don't fit neatly into the FAST acronym, and recognizing all of them is just as critical. Let's make sure we cover those next, because overlooking any one of these could delay crucial treatment. It's not just about knowing the FAST test, it's about being aware of the full picture of how a stroke can present itself, especially in those critical early moments when every minute truly matters. Beyond the FAST signs, there are other critical indicators that many seniors, unfortunately, might overlook or attribute to age or other minor ailments. The fourth sign we need to talk about is sudden confusion or trouble understanding. This isn't just typical forgetfulness or a senior moment. It's a sudden, marked change in a person's mental state. They might suddenly seem disoriented, unable to figure out where they are or what's happening. They might have trouble following simple instructions or carrying out everyday tasks that they normally do without thinking. A loved one might suddenly seem bewildered, asking repetitive questions or saying things that don't make sense in the context of the conversation. It's a rapid onset of cognitive difficulty. People might think they're just having a bad day, feeling overwhelmed, or maybe experiencing side effects from medication. But if someone who is usually clear-headed suddenly seems deeply confused or unable to process information, it's a serious sign. Imagine talking to your spouse or a friend, and they suddenly look at you blankly, not understanding what you're saying, or saying things that are completely out of character or context. This sudden shift in mental clarity or understanding is a powerful indicator that something is wrong with the brain, and it could very well be a stroke affecting areas responsible for thought and understanding. Don't dismiss it as just old age or fatigue. If the change is sudden and noticeable, it needs immediate investigation. This sign, like the others, points directly to a disruption of blood flow in the brain, and the brain cells affected are crucial for our conscious thought and awareness. The fifth early sign that is often missed involves vision problems. This is sudden trouble seeing in one or both eyes. It might be blurred vision, double vision, or a sudden loss of vision in part of the visual field, like seeing only half of what's in front of you, or losing peripheral vision. Sometimes people describe it as a gray curtain coming down over one eye. It's important to distinguish this from gradual vision changes or needing new glasses. This is sudden. One moment they can see clearly, or as clearly as usual, and the next, their vision is impaired. They might bump into things on one side, or seem unaware of things in part of their environment. They might complain that their vision is suddenly fuzzy, or that they can't see out of one eye. They might think it's just eye strain or something in their eye, or perhaps related to their existing eye conditions like cataracts or glaucoma. But if the onset is sudden, it's a red flag. The brain is responsible for processing what our eyes see, and a stroke affecting the visual processing areas or the pathways from the eyes to the brain can cause these sudden sight problems. If someone suddenly starts having difficulty seeing, even if it seems minor at first or affects only one eye, it warrants immediate medical attention. It's another part of the body where a sudden change in function can signal a serious brain event. Our sixth sign is one that can be quite alarming when it happens a sudden, severe headache with no known cause. Now, many people, especially as they get older, might experience headaches from tension, sinuses, or other reasons. But a stroke headache is different. It's often described as the worst headache of their life. Incredibly intense and abrupt. It's not a headache that builds gradually. It hits like a thunderclap. Sometimes. This type of headache is associated with a specific type of stroke, like a hemorrhagic stroke, where a blood vessel in the brain ruptures and bleeds. The sudden pressure from the bleeding causes intense pain. But ischemic strokes, which are more common and caused by a clot blocking a blood vessel, can also sometimes cause headaches, though they are usually less severe than with hemorrhagic strokes. The key differentiator here is the suddenness and severity. If you or someone you know experiences a sudden, excruciating headache, especially if it's accompanied by any of the other signs we've discussed, it is a medical emergency. Don't assume it's just a migraine or stress. This kind of headache is a sign that something potentially catastrophic is happening in the brain, and it requires immediate medical evaluation. It's the body's alarm system screaming that something is terribly wrong. Ignoring a sudden, severe headache could have devastating consequences. Finally, the seventh sign, and another one that can be easily dismissed, is sudden dizziness, loss of balance, or lack of coordination. This isn't just feeling a little wobbly when you stand up too fast. This is a sudden, significant instability. Someone might suddenly find they can't walk straight, or they're stumbling or falling without tripping over anything. They might feel intensely dizzy, like the room is spinning, and find it impossible to stand or walk normally. Their movements might become clumsy or uncoordinated, like trying to pick something up and missing entirely. People might think they are just tired, dehydrated, or maybe it's a problem with their inner ear. While those things can cause dizziness, if the dizziness or loss of balance comes on suddenly and severely, especially if it's combined with any of the other signs, like a headache, vision problems, or weakness, it is a strong indicator of a potential stroke, particularly one affecting the cerebellum or brainstem, areas critical for balance and coordination. If someone suddenly loses their ability to walk or stand steadily, or experiences sudden, debilitating dizziness, it's not something to wait on. It means the part of the brain that helps them stay upright and coordinated is in trouble. Recognizing this sudden loss of balance or coordination as a potential stroke symptom is crucial for getting help quickly. Because like all these signs, time is of the absolute essence. Understanding these 7 signs, facial drooping, arm weakness, speech difficulty, sudden confusion, sudden vision problems, sudden severe headache, and sudden dizziness, loss of balance, empowers you with the knowledge to act. And knowing what to do next is just as vital as knowing the signs themselves. So, we've talked through these 7 critical early signs that far too many people, especially as we get older, might miss or explain away. We've covered facial drooping, arm weakness, and speech difficulty, the familiar fast signs. And we've also discussed sudden confusion, sudden vision problems, a sudden severe headache, and sudden dizziness or loss of balance. These aren't just isolated symptoms. They are your body, or the body of someone you care about, sending out an urgent distress signal. The reason it's so important to recognize these specific signs, and to recognize them as sudden, is because they point directly to a potential stroke happening in the brain. A stroke means that blood flow to a part of the brain is interrupted, either by a blockage or a bleed. Without oxygen and nutrients from the blood, brain cells begin to die within minutes. And tragically, once brain cells die, they are gone forever. This is why time is not just a factor. It is the single most critical element in stroke treatment and recovery. The faster blood flow is restored to the brain, the less damage occurs, and the better the chances are for a full recovery, minimizing long-term disability. Thinking about these signs might feel a bit overwhelming, or perhaps a little scary, but knowing them isn't about creating anxiety. It's about empowering you to take decisive action in a moment of crisis. It's about shifting from uncertainty to knowing exactly what to do. Remember how we talked about the T in FAST, standing for time? That T means that if you see any of these signs, even just one of them, and even if it seems to go away, you need to treat it as a medical emergency. This is the crucial step that far too many people delay, often with devastating results. They might wait to see if the symptom gets worse, or if it improves on its own. They might decide to just lie down for a bit, or take some pain relief, or wait until their doctor's office opens. But during that time, precious brain cells are being lost. This brings us to that critical thing we hinted at earlier. The crucial next step once you recognize a potential stroke sign. It's simple, but it's the most powerful action you can take. It is to immediately call emergency services. In many English-speaking countries, this means dialing 911 or 111 or 9999 depending on your location. You don't call your doctor. You don't call a family member first unless they are with you and can help you make the call. You call emergency services. Tell the operator you suspect someone is having a stroke and describe the symptoms you are seeing. Emergency medical responders are trained to recognize stroke symptoms, and they can transport the person to a hospital equipped to provide life-saving stroke treatment, like clot-busting medications or procedures to remove the blockage. There's a limited window of time, often just a few hours from the onset of symptoms, when these treatments are most effective. Calling emergency services immediately activates the entire stroke care system, getting the person to the right place at the right time for the best possible outcome. Don't worry about being wrong. Healthcare professionals would much rather you call and it turns out to be something less serious than for you to hesitate and a stroke goes untreated. Your quick action could be the difference between a minor inconvenience and a life-altering event. Encourage your friends, your family, and everyone you know to learn these signs too. Have conversations about it. You never know whose life that knowledge might save. It could be a loved one, or even a stranger you encounter. This awareness is a gift you can share. Remember, while age is a risk factor for stroke, knowing these signs and acting fast significantly increases the chances of a good recovery at any age. It's about being prepared, being informed, and knowing that you have the power to make a critical difference in a moment of crisis. Small changes in awareness can truly lead to big differences in health outcomes and happiness. Don't let the fear of being wrong stop you from doing the right thing, which is to call for help immediately if you suspect a stroke based on any of these signs. Your proactive response is the person's best chance. Thank you for taking the time to learn about these vital signs. This knowledge is something powerful you now possess. Share it. Talk about it. Be prepared. If this information has been helpful to you, please let us know by leaving a comment below. Have you or someone you know experienced any of these signs? Sharing your story might help others recognize them too. And if you found this video valuable, please give it a like, as that helps us reach more people who need this information. And most importantly, if you haven't already, subscribe to our channel. We share important health and wellness information specifically for our audience to help you live your best life at every age. We're here to support you on your journey to a healthier, happier life. Live your best life at every age.